In this video, we're talking about prolapse.
What's all prolapse?
All of them.
Yeah?
Yeah. So, what is a prolapse?
Well, you've probably got a better definition than I do.
That's right.
Prolapse, in my mind, is where any part of the pelvis is moving down and out through the vagina into a position, lower than we would like it to be. So that could be the bladder wall that it shares with the vagina sagging and coming down, or it could be the wall that the vagina shares with the rectum sagging and coming down the vagina, or it could be the top of the vagina, the cervix or the uterus coming down as well. Do you want to add to that?
If you've had surgery such as a hysterectomy where your uterus has been taken away and maybe your cervix has been taken as well, you can actually have the top of the vagina called the vaginal vault actually prolapse down as well.
Yeah.
I like to think about prolapse as being a little bit like wearing your favourite undies all your life, and then the elastic actually starts to stretch, because with a prolapse it's your ligaments and your fascia, which are support structures, which actually start to stretch. And in our undie thought, the undies then start to fall down, they don't sit where they used to sit, and that's what our pelvic organs do too.
Yep. So no, that's good. And I guess we were going to talk a little bit about the anatomy when we were talking about this, just so that people can have a bit of a visual. This model is a demonstration of sort of like what it would be like if I cut myself from up between my legs like this, and then I put myself, the cut surface facing you, so that you could see my anatomy. And so here we've got the pubic bone, and then behind that we've got your bladder, which drains to the outside via your urethra. And then we've got the uterus, which joins into the top of the vagina at the top, and vagina follows down and comes out just behind the urethra. And then behind that we've got the rectum and the anus sitting, as you can see, really closely next to behind the vagina there. And so when we talk about prolapse, or any of these structures coming down, like our saggy undies, sort of lower or beyond the opening of the vagina, that would be called pelvic organ prolapse.
Great.
Right.
Yeah, so thinking about the causes of prolapse,
Yeah.
some of the things that actually can cause everything to stretch and drop can be pressures that are actually coming down from the top and coming down to the pelvic organs as well. So it could be a chronic cough that you have over a long period of time.
Yep. Which could be caused from smoking, from reflux, from untreated asthma.
It could also be from constipation, so straining when you're actually trying to do a poo.
Yeah. Some people suffer with constipation on and off all their life, so the occasional bit of constipation now and again probably don't think adds up to too much, but if you think about years and years of straining and bearing down and that pressure, right down on here, which is right next to here, we can start to see how over time probably that does start to take a toll there.
Childbirth is another one, especially with vaginal delivery, where people may need a bit of extra help. So it might be with forceps or some form of vacuum device. It may be that they've had a really long second stage of labour or quite a large baby.
Is the second stage the pushing?
It's the pushing stage,
Stage,
hard work stage, push that baby out.
And what about if people have had a caesarean delivery?
It doesn't tend to probably predispose them to the same degree, but even just being pregnant with that extra weight that's actually coming down can start to cause some stretching to the support structures.
And the hormones that people experience during pregnancy that start to cause things to sort of stretch and
soften,
get ready for, or just to allow for the growth of the baby, and then also getting ready for delivery, they have an effect beyond our just the pregnancy, don't they? So
Absolutely.
we think about getting varicose veins due to pressure and the changes of those hormones. There's sort of similar things happening in our connective tissue down below, isn't there?
Absolutely.
Yeah. Is it normal to have some amount of prolapse, Lisa?
Yes and no.
Yeah.
They do say that every woman that has had a vaginal delivery has at least a small prolapse, and they now consider that to actually be quite normal.
Yeah.
Because the tissues can't undergo that degree of stretch and then come back to what they used to be.
Yeah.
Yeah.
And I guess we can't expect people to, live a full, long life, and our tissues getting older and going through all the things that they go through without there being some degree of change and stretch.
Absolutely.
And so it's not gonna. We don't expect it to say exactly the same.
No. Our bodies change.
Yeah.
So on that note too, like when does a prolapse actually become a problem? And one thing that we always sort of talk about is this thing called bothersomeness. So, does it bother you?
Yeah.
And people may come in with a prolapse which we may think is quite small, and they might be quite bothered by that. Whereas other people may come in with quite a large prolapse and not be concerned at all. So everyone is very different in how much it bothers them, and then what we need to actually do to help people to improve it.
Yeah, I'd agree that I've definitely seen that spectrum of people sort of, they're either worried that they have the prolapse but they have none of the symptoms, or have symptoms and don't actually realise that they're due to a prolapse. So it can be any way.
Yeah, so what are the symptoms? What sort of things do people complain about or
They're
talk about?
They're quite varied actually, and it can depend a bit about on what the main part of the pelvis is sort of prolapsing. So for people who have prolapse of the sort of wall that involves the bladder, we can see obviously that might start to cause some urinary symptoms. So people might have some incontinence of urine. They might also feel that they can't fully empty their bladder.
Yeah.
Sometimes people can have recurrent bladder infections, like UTIs. They can also get the sense that they need to urinate frequently, and might have to go up overnight as well as a wee. I'm trying to think of what I'd like to add to that.
Another thing that I sometimes see is actually women that may have had some urinary incontinence who all of a sudden that stops.
Yes.
Because the prolapse has actually dropped down and it's pushing on the urethra, that tube that's coming down from the bladder, and it's actually stopping that urine from coming out as much.
Yeah. Yes, and then we try and fix their prolapse and we make their incontinence worse sometimes.
Absolutely.
Yes. But then we can help with that.
We can help with that, absolutely.
Yeah. And then I guess if we're moving sort of more centrally to prolapses of where the uterus or the cervix, the vaginal vault, if you don't have a cervix and a uterus up there is coming down, can sort of feel like, and I guess anyone with any of these types of prolapses can get this symptom, which is sort of like a bulge, or a feeling of a lump, or
heaviness.
Heaviness.
Yeah.
Something that's hanging down or between the legs. If the prolapse is actually making its way beyond the opening of the vagina, we can start to get some discomfort because of rubbing on underwear as well.
Some women describe it as a tampon that might not be fitting properly as well. Things just feel different.
I guess the prolapse is sitting in the pelvic floor, like in the opening of the pelvic floor a bit. They get that sensation.
Maybe. Yeah, maybe. Just feels different to what it used to.
Yeah.
Yeah.
And then other symptoms that may involve the rectum a bit more, maybe people finding it difficult to feel like they've fully emptied their bowel, or some women quite commonly find that they actually need to assist, like support the prolapse with a finger to actually be able to empty the bowel. Some other symptoms that might be less obvious as well, that people can have sort of like that dragging that we talked about, but it can almost feel like it's a back pain.
Back pain. Yeah. And sometimes even abdominal pain through the front too. So
great.
So thinking about having a prolapse, what are we going to do about treatment and management?
Well, I think the big thing to say is just if there's a prolapse but you're not having any problems or symptoms, it might be that we don't need to actively do anything about the fact that there's a prolapse specifically. It might be a good opportunity to talk about some ways to look after your pelvic health generally and think about, okay, how can I hopefully make sure that this doesn't progress to become a bother to me? So that number one, we might not have to do too much.
Yeah.
But yeah, I think like you were talking about, if things become bothersome in any of those ways that we're talking about, then there are definitely things that we can do.
Yeah. Thinking about the healthy pelvic habits and preventing a prolapse from getting worse. From my point of view, I do a lot of pelvic floor muscle training. So we would assess what people's muscles actually do, because the pelvic floor muscles sit at the base of the pelvis, which we can see here. We've got the pelvis where our organs sit in here, and then we've got that muscular base, which is there. So that's probably a better view, isn't it? But if we strengthen that, it will actually help to lift the prolapse up. And it's actually been shown in research that a stronger pelvic floor will improve a prolapse by 25%. So it will lift it up significantly, really, because there's different stages of prolapse, so different degrees of how bad that prolapse actually is or how bothersome it might be.
That's right. Yeah. So look, we can do pelvic floor muscle training.
We can.
We're going to do another video about healthy pelvic habits, so we might cover a few other things in that, so that might be a good one to check out as well.
What about vaginal estrogen?
Yeah, so our vaginal tissues and our lower urinary tract tissues and our pelvic floor muscles, they all have estrogen receptors, and so when we are after puberty and before menopause, we're making estrogen because our ovaries are cycling and we're ovulating, and all that estrogen that's getting made in that process is there supporting our tissues, and that estrogen
making them thicker. And
it helps with the vaginal tissue and the tissue of the vulva. With estrogen, it's got better blood flow, it's thicker, it's plumper, it's more resilient, it's more robust, it lubricates itself.
So it's holding everything up better.
Yeah, that's right.
As well.
Yeah. And even think about where your wee comes out, that's like that little hole there is like a plump cushion thing, and so when your muscles contract, that little plump sort of cushion thing can seal off nicely. When we lose our estrogen, levels start to drop, and then we stop making it completely. We lose that blood flow, we lose that plumpness, that thickness, that robustness. We can get things being very thin and almost like papery, like they could tear so easily. And I think about the urethra, and it doesn't have that sort of plumped, cushioned edges anymore. So when our poor little muscles, who've been through a life of hard work already, try to contract, there's none of that cushioning to help it seal.
And we can leak. I think we're going to do a video on that later, aren't we?
We are.
Awesome.
Yes.
Great.
So also check that one out. It's our video on urinary incontinence. But yes, we can replace vaginal vulval estrogen with creams or little tablet pessaries, and it's a very safe, for most people, way to give estrogen and to help with a lot of these symptoms. So if you're perimenopausal or postmenopausal, we may be considering using a vaginal estrogen product like that to assist with some of these symptoms, because it's amazing how much of a difference it can make.
Absolutely. There also is this little device which is like a split. So it's called a pessary or a support pessary, and it can go into the vagina and help to lift everything up and hold it up. And they can be great for some women.
We both do a lot of them, don't we?
We do.
Yeah.
And in order to use those, we do love women to have good vaginal estrogen levels as well.
That's right.
But it is another option for being able to help to manage a prolapse as well.
It's a really useful tool, isn't it, that can avoid the need for surgical intervention, and it can be very helpful, you know, even just temporarily, so like after childbirth, to help support things so that people can get back to, you know, exercising, going out and about without having to worry about, you know, incontinence, things like that. And then as the body recovers after childbirth and, you know, pelvic floor muscles sort of start to take shape again, and like the pessary for them might not need it.
Yeah.
But, you know, we've also got a lot of women that we're using it long term, and, you know, there can be a little bit of trial and error with getting the right size and things, but
So all vaginas are different?
yes.
Yep.
Very difficult to measure with a tape measure, aren't they?
Absolutely.
Yep. But they're not as scary as they sound. I might go and grab one.
A vagina?
A
A
pessary.
A pessary, yeah. Excellent.
To just
We can have
pop into this video somewhere.
Yeah. Now, what about the surgery option? I know from my point of view, as you know, not as a surgeon,
And I'm not a surgeon either.
No.
So,
but
we know some things about it.
we do, yeah. Well, one of the issues with surgery is it actually has quite a high failure rate. So about 1 in 3 women who will have prolapse repair surgery will actually find that surgery doesn't work. And even for the people that have successful surgery, or what they would call successful surgery, where they don't have those prolapse symptoms anymore, it has a limited life. So it will only last a certain number of years, and it can only be done as like a small amount of times through your life as well.
Exactly. And yeah, so it's something that I think plays a role for some people.
Absolutely.
It's very necessary, but I think it should be probably one of the last options that people look at, and trying to, you know, I think focus on the protective factors, the things that will stop things getting worse, you know, so that is sort of the last thing that, you know, if we're not winning with our other options, if you do end up having a surgery to help support these structures, then at least you've got the foundational stuff there to support it, so that if it is successful, then it's going to last as long as it can.
And we know that the stronger your pelvic floor muscles are, and the better they're functioning, the better people are going to do after surgery as well.
Yeah, that's right. And, you know, if you've addressed the problems with constipation and all that sort of stuff, you're not going to undo the good work that's been done at surgery. But yes, surgery, as we know, has risks, doesn't it? So we don't always know who's it going to be successful in, who's going to have complications, you know. So we could end up better than when we went into it. We could end up worse off. We could end up in the same position, and it is difficult to predict. So, but it does have a role.
Great. Well, thank you for that.
No worries. Oh,
Good. Yeah. High five.
okay.